Some lives teach us science, some lives teach us systems, and then there are lives that quietly teach us how to live. As we begin season 2 of Rebooting the Brain, we do so around World Braille Day, a day that reminds us that vision is not limited to eyesight and that dignity, access, and purpose can exist far beyond what the eyes can see. Today's conversation is with Dr. Satish Amarnath, a microbiologist whose work has shaped not just laboratories but lives. Long before HIV, AIDS, and hepatitis were spoken about openly, he stood with patients and families at their most vulnerable moments, breaking myths, building awareness, and introducing systems that transform care.
HIV/AIDS is among those, and basically, one of the reasons is that the population that was affected initially by HIV/AIDS were drug users and men who have sex with men and prostitutes or people who had a lot of sexual partners. And so, and it's also a deadly disease. And so I think the combination of those two things made HIV/AIDS carry a lot of stigma.
From JIPMER to Manipal Hospital, Bengaluru, he helped create infection control practices, digital hospital systems, and clinical protocols that went on to inspire doctors and institutions across the country. And then, in 1998, life changed in an instant. A brutal acid attack took away his eyesight and altered his face forever. What followed were surgeries, silence, grief, and a complete relearning of how to exist in this world. For many, that might have been the end of a professional life. For Dr. Satish, it became a turning point. He returned, not despite his blindness, but with a deeper sense of purpose. He went on to lead infection control, quality, digital health, corporate wellness, and inclusion for the differently abled. He empowered teams across hierarchies, supported families through illness, and continued to build systems that placed humanity at the center of healthcare. On a day dedicated to Braille, a language of touch, resilience, and inclusion, this conversation reminds us that loss does not define limits and disability does not erase purpose. This is Rebooting the Brain, and this episode is about what becomes possible when willpower refuses to surrender.
ജ്ഞാനാനന്ദമയം ദേവം നിർമ്മലസ്ഫടികാകൃതിം ആധാരം സർവവിദ്യാനാം ഹയഗ്രീവ ഉപാസ്മഹേ ഹയഗ്രീവ ഉപാസ്മഹേ.
Rebooting the Brain, powered by PRS Neurosciences. Namaste, everybody. Welcome to the season 2 of the podcast Rebooting the Brain. We have had a very successful season 1, which we started in December 2024. And we have loved each one of you who have watched the channel, followed us, given your comments. Some of them have been very intense. It helped us to, fine-tune what we are doing and who we are and everything else. So thank you very much for it. We continue to look forward to this continued love, affection, and please do continue to share this with as many people as possible, because we promise you world-class content for the common person in a language that each of you can understand. Hi everybody, my name is Dr. Sharan Srinivasan, and before I start today's podcast with a very special person, let me first do this Shanti Mantra. Om Asato ma Sadgamaya Tamaso ma Jyotirgamaya Mrityorma Amritam Gamaya. Om Shanti Shanti Shanti. This shloka has been the guiding force from me right from my childhood. And as the shloka says, from darkness to light, from ignorance to enlightenment, and from death to immortality, this science of funda can be used at any part of your life on any given day, and make you a better human being. All right, before I go to the guest of the day today, guys, the usual housekeeping rules. Please don't forget to subscribe to our channel, hit the like button for this video and all the other videos we have there on all our channels. Number 3 is share each video widely with every loved one that you know who will benefit from this, or they can help somebody else. And also, obviously, don't forget to comment. Generous comments is what we want, because comment increases engagement and that will help us reach to more and more people. So today I'm introducing you to an incredible doctor, a gentleman, a warrior par excellence, and his name is Dr. Satish Amarnath, a senior microbiologist, and beyond that, a fantastic warrior and human being from Bengaluru, India. Dr. Satish Amarnath, welcome to this podcast, Rebooting the Brain.
Thank you. Thank you very much. It's really wonderful to be here. It's my privilege. Thank you.
Perfect, sir. So as you saw in the introduction of this video, we had a lady from the US talking about HIV, in the layman's terms, AIDS virus, and the myths about that. I know you have had a great experience with working with HIV, many, many decades when HIV was just entering into India and there were so many myths and so many fears there. Can you tell our viewers your own journey and also about what this HIV is all about and the myths and everything else?
Begin with, I think HIV virus was initially identified in the United States.
Okay.
More importantly, in a group of individuals who had a negative connotation, that is the gay people.
Okay.
Or homosexuals.
Okay.
Now that was something that really put this virus into a perspective to tell that only people who had aberrant sexual behavior would get this virus.
I see.
And you won't believe this. This persisted for quite some time. And then India told, since we are a race which believes that such things should not be practiced, we will not get it.
Oh, really?
Yeah.
Oh.
And you won't believe this. 1986, we saw the first few cases in Chennai.
Okay.
That was Madras at that time.
Correct.
And it was seen in commercial sex workers. And the people had to eat the words that talked about. And let me tell you also that homosexuality is one part of the transmission cycle. It is transmitted by sexual activity. It is transmitted by blood donation, because at that time, none of the blood donated anywhere was being tested.
Really?
Yes.
Oh.
So I initially remember very clearly that India had a policy telling that any individual who's detected as HIV, who comes from abroad, because that time it was mandatory to test them, they turned positive, they would be immediately deported.
Oh, I didn't know this.
Yeah.
I see.
This was the policy in 1986.
Okay.
87 was the first foreign national positivity I got in Pondicherry.
Okay.
It was a Swedish national, wonderful lady. I'll tell you, she came into the hospital telling, I am HIV positive, please take care. I mean, imagine, Dr. Sharan, who will tell that?
Exactly.
With the stigma that is there.
Even today.
Even today.
Exactly.
And this lady came and told, and I was told, because as per the government guidelines, I had to test her and tell that she is positive.
Okay.
So I remember going into that isolation room where she was kept. And on the way, I saw her food was kept on the floor, which I really hurt my feelings.
I can imagine, like a outcast or this one,
Absolutely,
whatever.
Because nobody was prepared to go into that room.
The fear or whatever.
Yes, because the fear was too much.
The same thing we saw in COVID in the initial stages.
Yes,
sir.
yes.
I remember.
I walked into the room, took the tray of food and kept it next to her side table and told her, please have this after I collect your sample. And you won't believe this, Dr.
Mm,
Sharan. When
mm.
I walked out with the sample, people were looking at me from other rooms. They were not even prepared to come in front of me. They thought I will be transmitting the virus. And
Correct.
she turned out to be positive. We had to deport her. But that was the first case I saw.
But that's the courage you had when nobody else. What gave you the courage when everybody else was running away in the hospital, sir?
Because I knew very clearly how the virus is transmitted.
Brilliant. That means knowledge is power.
Power. Absolutely. I had read a lot about this, and luckily for us, there were a lot of Government of India information that was sent out to us because we were the serosurveillance center of Pondicherry.
JIPMER Pondicherry.
Yeah.
Mm.
And you won't believe this, it was very clear. The virus is transmitted by being exposed to blood and body fluids.
Correct.
It cannot be transmitted by air or just imaginary this thing that it can't fly and reach your body.
So a lot of people think even I should not even handshake a HIV positive patient, and when they've seen me handshake, they think I'm crazy to do that.
In which case, I think I would have been positive the thousands of times. I have shaken hands with the people who are HIV positive, taken care of them, counseled them very much because, nobody gives them correct information.
True.
Very clearly, I've told them, this is how you manage this thing. This is how the virus is transmitted. I tell them very clearly. Any cut, any body fluid, be it, let us say, saliva or, genital secretions, be very clear. This can transmit the virus.
Correct.
You should be extremely careful. And you won't believe this. I had a patient who was HIV positive.
Okay.
I had to counsel her very clearly, telling this is possible. That is, you can stay in the same house, you can do your routine course, but if there is a cut, if there is this thing, please take care.
Correct.
And these are the things that we told very, very clearly. And you won't believe it. These people really took care. I have had the other spouse in the same family not infected. I have children for this people who were born before they were, one of them had returned positive, perfectly living under the same roof without any problem.
Very good.
And that is the important thing about things. I also remember a case where the husband donated blood for the wife. That time, guided donations were very common. He turned out to be positive. Again, as I told
unknown
you,
positive.
He was positive.
But unknown positive. He
Unknown
didn't.
positive. He gave the blood to his wife. She
Ayyo.
turned out to be positive, and she had just delivered a baby. So you can imagine the
Crazy.
Mental agony they went through.
Crazy. I can imagine.
And that is the time we started testing as a mandatory requirement all donated blood.
Which makes sense. Which absolutely makes sense.
Yeah. And the virus is very, very sensitive. You put it out on the open and expose it to a high temperature, finished. Zilch, it dies.
Correct. Very true. That I've heard.
So this is very, very important that we have to keep in mind. And
so you're saying that as long as you don't come in contact with the body fluids of the patient or the person, you will never have a risk of getting the...
Yes.
So I'm going to ask you a follow-up question to this. See, I as a neurosurgeon have operated HIV positive patients, quite a few of them. And I know the risk that I'm taking because sometimes the blood spurts on our face, the blood is on my shoe, the blood is on my pajama and things like that during surgery. So we obviously take our own care. We double glove all the time, but we put our extra, the goggles and things like that to take, and the boots and everything else. So, but if the skin is intact, and if the blood or any body fluid falls on the skin, what is my risk of getting HIV?
Look, until and unless the skin, as you rightfully told, being intact, will not allow the body fluid to enter. Of course, you have to make sure that you clean that exposure as soon as possible. Number two, very important, you should not scrub that area because that will have micro abrasion. You have to very clearly take a solution or an alcoholic based solution, pour it over that area and then clean it up. And of course, you very correctly told double gloved, and you see that you take care of your knife so that it doesn't
Correct.
hurt you.
Knife and the
All
needle, those are the
those.
two
Yes,
things.
yes.
Yeah, these are two common
Knife
risks.
and needles can enter the body and put in the virus.
Correct, absolutely.
That's
so
the thing.
Yeah, the needle stick precaution is what we commonly use.
Yes.
So the next follow-up question is, people have heard both these words, HIV and AIDS. Are they the same?
HIV stands for human immunodeficiency virus. It's a virus.
Correct.
Now that virus causes AIDS. Now what happens? Once the virus enters
What is
your
the expansion of AIDS, sir?
acquired immunodeficiency syndrome. Okay. Now, why it is acquired is because you acquire it. And because you acquire the infection, you go into immunodeficiency. I'll come to that very clearly. Now, once the virus enters your body, it goes into a cell called the CD4 cells.
Mm-hmm.
That's where it multiplies.
The CD4 cell is a type of WBC?
WBC.
White blood cells.
Yes.
Correct.
Now, once it goes there and starts multiplying, it's a RNA virus.
Okay.
It
Like our coronavirus.
Yeah. It converts itself to DNA,
Mm-hmm.
gets into the cell and takes over the machinery of the cell
Whoa.
to manufacture itself.
Like a terrorist.
Yes. So now you have a potent factory going on in the body, and over a period of time, you find that these cells are diminished. And
they finally kill the cell.
No, the cell will be alive, but it's not doing the primary function.
It has no capacity.
Yes. So what happens is these cells become less and less. Now, for the immune function to go on, it is not that the numbers have gone down. Are you understanding what's happening? I have a CD4 cell. That cell has been taken over. Instead of doing its original job, it's reproducing HIV viruses.
Oh, Ramachandra.
That's how, over a period of time, you find that the body is not able to mount immune defense mechanisms to ordinary infections.
So immunity means our capacity to fight an infection which we acquire from the outside.
Yes. And that is why it is called acquired immunodeficiency syndrome.
That means a person like you and me who's immunocompetent, whose immune system is normal, the way we fight infections and the way they fight infections is very different.
Very different.
And what may not affect us can kill them if we are not careful with that.
Any ordinary pathogen which we would ward off within no time will become very, very serious in them. And they are unable to mount that immune protection to see that they overcome the infection.
That means their soldiers are all very weak and debilitated.
Yes.
The CD4.
That is why we do the CD4, CD8 counts.
Correct. And so, what is that? Can you tell them about the CD4, CD8
now
counts?
We take a little bit of your blood and we count the number of cells by immune markers, which are cluster differentiation 4 and cluster differentiation 8 cells. Once we get a number and we look at the number and see that these cells are not really up to the mark, we know that you are going into immunodeficiency.
Got it. So now, again to tell our viewers, there are people who can be HIV positive for years together and be completely normal like you and me and never ever suffer from the AIDS disease. AIDS is the disease, HIV positive is hosting the virus. Now, this guy who's positive but not having the disease can at any point of time communicate or transmit this disease to anybody else. That is the safety that he has to take, but he himself may never suffer from the AIDS disease.
It takes quite a lot of time.
It takes a lot of time.
Also depends upon how good your immune system was even when he got the infection.
I see.
Let us say you are healthy, absolutely young. The chances are there you'll go a decade before you start.
Oh, really?
Yes. Before you start going into this thing. Now, please understand, this virus is not something that will keep on multiplying.
Hmm.
The body's immune defense mechanism, which is the antibodies we test, is also functioning.
Correct.
So the fight is on. So there is a variation of the number of viral particles that are there in the body, and that increases and decreases. And that fight goes on up and down. Over a period of time, the body's immune cells start losing. That is the time when you start getting uh, acquired immunodeficiency syndrome. And please understand, in some people, it can be very fast because they have other comorbid conditions which has decreased their immunity.
Like what? Like, for example?
Like take for instance, they are already having, let us say, allergies. They are having certain cellular deficiencies of the white blood cells. Those are the people, or let us say cancer. Those are the people who might progress faster.
Cancer on the chemotherapy and
Yes,
things like that.
on chemotherapy.
What about diabetics? Are they have a higher risk than a non-diabetic?
Not really.
Not really. Got it. Excellent. So diabetes is not at higher. So are there stories or evidence that you have seen where somebody had the AIDS disease and then has got out of the disease and become just HIV positive and gone into a what we call as a remission or something like that?
Okay.
Is that possible?
Very good question this is. Please understand, there is a trial that is going on. When I started managing these cases, I had nothing to give them.
Oh, no treatment at all?
No treatment at all.
No vaccine, nothing?
Nothing.
My goodness. Then you only pray to God.
No drug, nothing.
Sure,
Only thing I could do was counsel them, manage their mental trauma, and see that they have managed.
How long did this go on like this with no...
It went on for nearly about 5 years before we had the first drug coming in.
Oh, I see.
So, somewhere in early 90s, we had the first drug coming in. Then again, please understand, these drugs were costly in India because we were importing it.
Correct.
And then India produced it. And today, we have drugs. If you are positive, if you are maintaining your proper lifestyle and these drugs, one tablet a day can keep you going for a long time. I have one medical personnel whom I put on drugs. She's perfectly as good as you and me.
And for how long?
For about now 15 years.
Wow. Fantastic.
But she's very adherent to her health.
Discipline is most important.
Yes.
Excellent.
And also there is a recent trial that is going on where the injectable, which will stop the virus multiplying, I need to take that injection once in 3 months or 6 months.
Apart from continuing the tablet?
No, you don't take the
tablet.
tablet.
You don't take the tablet at all. You just take this injection and then be done with that.
This is going on in South Africa, that region, and that study is very, very,
encouraging.
Encouraging,
Okay.
and it will be able to manage these cases.
But it hasn't yet come into India?
It is still not
come into India. But is it commercially available?
Yes, it is commercially available. We can get it.
Now, what you're saying is, it's much better than before.
Yeah.
And how does a HIV positive patient know that his immune system is still fighting, he's still okay? Does he have to do periodic blood tests and things like that?
Yes, periodic blood test. Number one is we look at the antibody status.
Okay. Which antibody?
The HIV antibodies.
Okay.
In addition to that, we look at the CD4, CD8 cells.
Okay.
And we do another thing called HIV viral load.
Viral load?
Yes.
Got it.
That is
all
a
these
PCR.
Are blood tests? All these are
blood tests. And that's a PCR test.
Okay. Like how we were doing in COVID, how much is the percentage of virus?
How much viruses are there in the body and what is the count?
Got it.
And this we regularly monitor.
How regular? What do you mean by regular?
Once a year at least.
Once a year.
And if there is any change in the infection status, if it throws up some, infection, either the lung or the gut, like diarrhea, then we monitor this CD4, CD8 cells, and we also look at the viral load. You'll find that the viral load is going up, the CD4 counts are going down. Then we know that we have a unbridled viral multiplication, which is causing the
Got it.
immunodeficiency.
Perfect. Now, I have a follow-up question to this, sir. Now, let us say a woman is HIV positive and she gives birth to a baby.
Yes.
What is the chances of the child being born HIV positive?
A very good question. Again, please understand this. In utero transmission possible,
Mhm.
but not very common.
Oh, really?
Yes. What
Oh.
we do is,
Huh.
once I come to know, because you see now, most of our antenatal cases,
Mhm.
we test for HIV
Ah,
even before we do anything.
I see. I didn't know this. I see.
HIV, hepatitis B, and this thing, HCV, we
HCV.
test.
Got it.
And most commonly, it is HIV and hepatitis B.
Hmm.
And if you're positive,
Mhm.
there is chances that just close to the delivery,
Mhm.
we start medications for the mother to bring
Okay.
down the viral load.
Ah,
Again, everything depends on the viral load.
okay.
And if the viral load can be managed, once the baby is delivered, we see that we take care of the baby and, of course, monitor it. And
Oh, I
please
see.
understand, if I
Huh.
test for antibodies in the baby,
Huh.
the chances are there I'll tell it the child is positive. I
Not
have to do a
necessary.
viral
Oh,
load.
that's an interesting information. I
Because
see.
antibodies go across. Now, that
Correct,
is
correct,
why
correct.
we vaccinate women when they are pregnant.
Ah, got it, got it. Perfect. I didn't know this because I mean that I think it's long ago. I think initially when the woman did not know she was positive and then they gave birth, then the child will be positive.
Yes,
Correct.
yes,
So
yes. Again, please understand the blood that is there
Hmm.
when we are taking care.
Mhm.
When the delivery occurs,
Mhm.
there is a mixture of the maternal blood as well as
The baby's
child
blood.
blood.
Correct.
And chances are that it will fall on the child.
Ah.
That is again
That
the way
so
it
the
is.
transmission is more like that rather than through the placenta.
Very rarely to the placenta.
Oh, even in the mother who does not know she's HIV positive and gives birth, really?
Otherwise, all the children born to HIV positive mothers would have been positive, right?
Oh, I didn't
Not
know
all of
this.
them were.
I see. I didn't know this because I'll tell you why I'm asking you this question. I operated recently a Jain Swamiji.
Okay,
He was about 29 years old. He came with a brain tumor.
okay,
And we thought that, and he was known HIV positive. And again,
okay.
he was born HIV positive,
Huh.
okay, because of the mother. And he was a saint now, and that tumor I had to biopsy. So I went in and I did the surgery and I biopsied the tumor and turned up with tuberculosis.
Oh.
So, and as we know, and there was a mixture of, I think it's either tuberculosis or a fungus. I can't recollect what it was. But anyway, it was an immunocompromised situation. And clearly we understood that his immune system was not competent. His counts were different. And then we were trying to, treat him. And that's when we were looking back and seeing how the mother became, positive and how
Positive.
she transmitted and things like that. But I didn't know this
No,
information that...
again, basically look at it. 29 years he was comfortable.
Yes, that's what I was going to say next. Yes.
Yeah, and please understand his lifestyle and his way he would have taken care of his body was good. So though he was infected in childhood,
At birth.
at birth, he manifested with immunodeficiency at the end of 29 years. So it's all depends upon how well you maintain your body. And tuberculosis, fungus, again, I've seen tuberculosis occurring in organs, my God, which we don't commonly see. Tuberculosis is commonly seen in the lung, isn't
Correct.
it? I have seen florid tuberculosis occurring in the what you call gut,
Mm-hmm.
brain,
Mm-hmm.
and costing the person's life, because treatment again is not very effective.
Since you brought out the tuberculosis, I'll tell you my own story. When I was in MHB, Manipal Hospital, Bangalore, doing my DNB neurosurgery in 1990s, that's when we met. By the way, I know Dr. Satish Amarnath since 1996. So it's nearly 30 years, 40 years, sir? 96,
40 years.
2006, 2016,
One more year, 40 years.
30 years. My goodness, crazy. 3 decades. One more year, 3 decades, I know, sir. So I developed a painless swelling in the lower portion of my jaw
Okay.
in 1999, a submandibular gland lymph node. And I was just 6 months from my final year exams, no time to even breathe. I was running around. I would show that ENT, you remember neurosurgery department next to ENT department.
Yes, yes.
So I would show the ENT registrar on my way to somewhere. He would say, any on antibiotic togo, and he would say this and that, no fever, nothing. Finally, in 6 months, it became so big. It was nearly 1 inch wide.
Oh,
I could see from a mirror 10 feet distance.
okay.
Then I thought something was going on here. I went to this one. They said, let's do a FNAC. They did a needle biopsy and it came inconclusive.
Okay.
Then I said, nothing doing, let us do a full biopsy. So Dr. Niranjan, actually, because plastic surgery was on my neck, he did a skin crease incision and he excised the lymph node. It came out tuberculosis. Everything normal, sir. ESR normal, blood test normal, every damn thing was normal. But then I always keep joking, I got TB because my immune system was down because I was the mercy of the Manipal Hospital canteen.
Anyway,
Yeah.
Dr. Niranjan's handiwork is what you see in my face.
Yes, we'll talk about that. Of course, he's such an amazing gentleman.
Tuberculosis, as I told you, I have seen from innocuous infections like a lymph node swelling to florid infection.
I know, sir. I agree. We have only operated and treated
Yes,
so many
yes,
and who have
yes.
died also.
Yes,
Just because
yes.
it's just amazing. It's such a dirty disease.
And also, again, another disease which had a lot of stigma. And people, once they come to know they have tuberculosis, they will again hide.
Correct.
That is the problem.
That's why I'm saying it on camera, because so they understand. I think we doctors have one of the highest risks of developing tuberculosis.
Yes.
Because we see so many patients of TB in our practice every day.
And they come and cough in our face.
Yes, cough in our face. Exactly. I agree. They cough in our face.
And it is transmitted by those droplets.
Aerosols, yeah.
Yeah.
So I always tell people, my occupational hazard is HIV, HBsAg, tuberculosis and all of those things. Like you have some other occupational hazards. So it's amazing what you said about, HIV and AIDS and all of that. So let us talk about one more virus, another friend virus that which bothers us equally is hepatitis B. So, sir, you have also had a lot of work done on the entire hepatitis viruses itself.
Yes.
So, can you enlighten our viewers about what this set of viruses are? How do they bother us, and how are they same or different from the HIV?
Okay. It is like taking an alphabetic class.
Okay.
I have viruses of hepatitis which are labeled as A, B, C, D, and E.
Oh. Any more are coming up, sir? B, C, A, F, G?
Maybe. I don't know. So, if you look at the A and the E, these are viruses which are transmitted by contaminated water. Because please understand, it's only now that we have toilets everywhere. There were a lot of people who suffered from jaundice. When they passed motion, the virus from the liver used to be shed into the gut, and through that again used to enter the drinking water.
Because of contaminated drinking water.
Yes.
So I myself had hepatitis A when I was a child, sir.
Yes. So A and E are water transmitted diseases or food transmitted diseases, whatever you want to call it. The B virus is unique in the sense that it is a virus which again transmits something like HIV.
Correct.
You need blood and body fluids to fall on another individual or penetrate the individual. And do you know how much of the virus is required?
How much?
For HIV, I need 0.02 ml to transmit. For
0.02?
0.02.
My goodness.
You see how small that drop is. And for hepatitis B, I need 0.00004 ml.
Wow!
Can you imagine how little I need?
Crazy.
And unfortunately, this risk very much for healthcare workers, but it is there for communities. I have seen this virus very common in certain parts of Andhra, old Andhra I'm talking about, and Karnataka. And you know why? Very simply because before the disposable blades for shaving was used by the barbers, we used to use what is known as the knife. That other one.
Correct. Ajam knife.
Ajam knife. That knife, if you can get contaminated, you can imagine what will happen. I come and get myself shaved with that knife, and then another person after me, he will definitely wash it. But look at the amount of virus, 0.404 ml, hardly anything. And you would have seen that he used to sharpen that knife with the leather. This thing.
Correct.
So the virus, if I had, he will put it on that leather strap. Every time he tries to sharpen it, he'll get the virus onto that knife and it will transmit.
And this virus is much more stronger and more stubborn than
much more hardy
much more hardy than this. That's why I hear it's 300, 400 times more virulent than the.
Yes. And you see how much is needed for you to get infected.
Amazing. And you told me the story of a doctor who entire family got infected because of this.
Yes. Again, basically, when I went there, we called this knife as cutthroat knife. So I was surprised in the sense that only male members in the family were infected. And this has a tendency to have you have jaundice like hepatitis A and E, which can manifest very badly. Then subsequently it goes into a quiescent stage.
Correct.
Where the virus is there in your body, you're a little better. Your liver, of course, is compromised. Your bilirubin is higher. The liver enzymes are higher. But you do not realize that you're positive. And you can transmit the infection from...
Same, like HIV positive versus AIDS.
Again,
HB positive versus...
very commonly through body fluids again.
Same mode.
Sexual mode, also possible. But I would say, because of the amount of virus that is needed, if they are all in a family, it is very common to see that they will infect one another.
Oh, crazy.
In addition to that doctor's family where all the male members were positive, I had another case where the lady had delivered in a small hospital. You won't believe it, she was positive, and it goes into what is known as a carrier stage.
Correct.
Where the virus is not multiplying actively, but it is definitely demonstrable in the blood. She came with her child. Luckily, the child was negative. Husband is negative. And I had to counsel them and this thing. Another child came to me by another family, again delivered outside. Virus actively multiplying. And this child has completed now her PhD in the US.
Whoa, really?
Yes.
And positive from birth?
Yes.
Wow.
And this girl really follows everything that is told to her. And touch wood, recently I have seen that the viral load has tapered off and it is showing that she's a carrier. It's not actively multiplying. But once the trigger occurs, we'll have to see.
You never know. So I know for myself as a surgeon, all our surgeons, we have to take the hepatitis B vaccine. And you were telling that you had a big role to play in introducing vaccine in MHB. Can you tell us about that?
You tell me, even today, you have students entering the medical fraternity, both medicine and dental, and allied health, this thing. Tell me how many colleges today enforce vaccination. Simple thing, no?
Honestly, I have no answer to your question, but that key word you have asked is enforce. I have no idea how many are enforcing. It's like gunpoint.
No, not gunpoint. You have to sit with these students, tell them the damage that can occur.
Correct.
Because you get infected.
Correct.
Your liver gets damaged.
Correct.
It's the threat to your life.
Correct.
Isn't it good to take 3 injections?
Absolutely.
Then after that, test yourself that you are protected. 10 milli international units of antibody is what it protects. That's all. And as I told you, I was very clear when I came into MHB. I saw that we were not doing it. We asked the management, this is what we need to do. This is how much it's going to cost to vaccinate an individual. This is how much it's going to cost the hospital if the person comes down with hepatitis
B
infection and takes leave and perhaps be a threat to other patients. They agreed and we enforced vaccination as well as screening. We screen for all 3 viruses. If you have seen health check when you do.
I see that.
We do test you for HIV, hepatitis B, surface antigen and HCV. Again, basically because we were very clear that this needs to be done.
So I remember I was obviously one part of the recipient of your anti-vaccination program. I mean, vaccination program. Because, and I should compliment and acknowledge MHB because they give it to us free, if
Yes,
you
yes,
remember.
yes.
And that for a private corporate hospital to take care of their employees like that and give it free, I think it's not common at all when today everybody is looking at profits and
Absolutely.
everything else. I think that philosophy of Manipal has still stayed, I think,
That
significantly.
philosophy was very
I
clearly a
agree, sir.
return on investment.
I agree, and I think
And I would say it's also very important the management,
correct.
the top consultants like Dr. Ballal, Dr.
MG Bhatt and
Shet, MG Bhatt,
AS Hegde,
they were very supportive. And in fact, they were also supportive for me to start the hepatitis C virus screening.
Mhm.
Dr. Ballal came back to us and told, my dialysis patients are getting HCV. And mind you, at that time, the blood bank was not testing for hepatitis C. It was not mandatory.
I see.
Now, when we went into this thing, the one common factor we saw was blood transfusion. And then we started testing, and you won't believe it, Dr. Sharan. We started blood bank screening for hepatitis C even before the government of India made it mandatory.
Amazing, sir. I'm not surprised. I'm not
Again, I would
surprised.
be proudly tell that our management was very forward looking.
I agree, sir.
They looked at how we can prevent infections
Mm.
and how to make sure that people's life were enhanced.
I think the philosophy came, see, Manipal itself, I think, got transmitted to the Manipal Bangalore and, got it ahead. So just to tell our viewers, which I always tell people, HIV and HBsAg, the two viruses, hepatitis B virus is 500 times more virulent than HIV, but HIV has got the sexy connect
Yes.
that the HBsAg is not there. So people look at HIV very differently.
Yes.
And HBsAg is the poor man's, HBs is the poor man's disease and the rich man's disease. I think that's why.
HIV has the stigma, no, because of sexual transmission.
Exactly. That's what has happened. And
So
that,
that
and
is
I
the
think
thing.
a lot of hepatitis B positive patients land up with hepatocellular carcinoma later on in their life.
Yes.
No, sir?
And not
Can-
only hepatocellular carcinoma, they
Cancer.
have liver failure.
That's that cirrhosis also.
Yeah, cirrhosis.
That's right. That's right.
That is much more common. Hepatocellular carcinoma is one end of the spectrum.
Correct. You're right.
And more importantly, their life of transmitting to another spouse and children is much more. That is the thing that we need to see, and that is how I'm very, very happy that Manipal put this across and replicated it in all the other hospitals across
Fantastic.
the group.
No, I really appreciate that. I really appreciate the management. So, guys, you see, Dr. Satish Amarnath is a passionate microbiologist. So, for those of you who think microbiology is not such a glamorous specialty, is not so important, do, and all of those things, can you see how we have just spoken about two viruses? There are 100 other things that he can speak about for the next couple of days, probably, if he keeps speaking.
Very true. Very true.
But then let me ask him a critical question, zoom back. Did you want to be a microbiologist?
You have asked me a very, very important question in the sense that
I can see so much of passion in you when you're talking about these things.
my father, I would say, had done at that time what is known as inter.
Okay.
That was a little more than 10th standard.
Correct.
And my mother was a 10th pass.
Oh.
But both of them made sure they sacrificed a lot of money to get me a lot of good schooling.
Excellent.
You won't believe it. I studied in Sophia's. At the end of the third year, the school asked me to get out.
Correct.
Because I was not a girl. Then I went through Baldwin's and for 2 years, that's fourth and fifth. And from 5th standard onwards, I continued at Bishop Cottons.
Okay.
And these are premier institutions of this thing. And for a family, my dad was very good in working. He worked with the British Army in the supply chain, and then he was in the transport company. But
I see.
Even at that time, a major portion of his salary went into my fees. What he made sure I had a good education.
I think that is very unique to Indian families, sir,
Yes,
Indian
yes,
parents,
yes,
Indian
yes.
families.
And I thank him for that, because in these schools I learned to understand how to not mug up,
Mm.
but more importantly to understand the
Mhm,
subject.
mhm.
Now, it was his passion and my mother's passion that they wanted me to be a doctor.
Okay.
But these are ICSE schools where I
Mhm,
studied.
mm,
And PUC also I did in Bishop Cottons.
mm,
My marks were not good enough for me to
mm.
get a seat
Correct.
in the medical college. I wanted to make my father's and mother's dream come true.
Mhm.
So I went and did my BSc, 3 years, with additional physics as an additional subject.
Mm,
And in addition,
mm,
that gnawing fear was there,
mm,
that what if I don't get medicine again?
mhm,
So I took up that time a vocational course, as it was told,
mhm,
in Central College, Bangalore,
mhm.
where evenings I used to go and study industrial microbiology.
Oh, it was not part of your BSc. You did this
No, no,
separately.
separately extra, because this was backup. This thing was backup. I
Got
should
it.
have something to fall back on.
Got it. Got it.
And there I learned to make wine. You won't believe this.
Oh, I see.
The red wine that is
So why
manufactured.
a wine connected to a microbiologist?
Yeah,
Huh?
because
I'm a teetotaler, so I have no idea. So please
which is the
educate me.
yeast which makes that wine.
I
And you won't
see.
believe, the first batch of wine I made, I'd kept it for filtration in the cold room. My friends drank it and put a label on that telling, you don't have to test it, it's very good. But
Maybe you had a good your business of going into winemaking, sir. Huh?
No, I studied how we can make drugs, because many of the drugs that you see and are used are manufactured by bugs. Then I also learned how to make, various other things, like the bread that you eat. It actually puffs up is because of, again, a yeast. So all these I studied, and that was a backup. But luckily for me, 10% of the seats were reserved for BSc graduates. My marks were good enough for me to get into Karnataka Medical College, Hubli. I didn't get into BMC Bangalore, but Hubli, and that's where I studied my MBBS. And you won't believe it, at the PG at that time, no entrance exam and all. No? We used to go for counseling based on marks. The chairman of the selection committee asked me,
For
what do you
for
want?
post graduation, for PG.
Yeah, for PG. I told, I want microbiology.
Mm.
He told, what?
You
You want microbiology? And microbiology had just separated itself from pathology at that time, just about 3 years earlier.
I see.
And you won't believe it.
Surprised that you didn't want a clinical subject.
Yeah, he was surprised, you'll get surgery.
Mm.
I told, no, sir, I want microbiology.
Now you see, guys, he was crazy, to pick up microbiology.
No, it was a passion.
I agree.
Basically.
I agree.
And, I have no regrets, because I've dealt with the very dangerous pathogens, and touch wood, up till today, I've succeeded in trying to quell them.
Sir, of course, because your support for us as clinicians, as surgeons is so critical in managing our patients and, getting them back, to their life or to their health. No question about the fact that the microbiology is a backbone of what we do. Because
Correct.
they deal with all the infection, whether it's bacterial, fungal, parasitic, viral, whatever it is, they're behind us.
Yeah. I always keep explaining it like this. You have something that you can see, like fungus, with your naked eye. You have bacteria, which you need a microscope. Then you need a electron microscope to see the viruses. And of course, the prions. I am sure you would have dealt with prions.
Correct.
So these are the issues. It's been a wonderful journey, let me assure you. It has been challenging very much, but every time I've isolated a bug and I've been able to make that diagnosis, I would run back to the clinician, tell, this is the bug I've isolated, and it perhaps have saved a life somewhere.
So you were telling me that during the interview you selected microbiology, and then you told me the story of your final year MD exam. Tell us about that story and your experience with your future mentor.
Again, you won't believe this. I had 3 examiners
Okay.
and 1 candidate.
What? Really? You were the only candidate?
I was the only
Oh,
candidate. Because
Ramachandra.
again,
What?
Dr. Sharan,
Huh?
microbiology, even in those days, it was not very popular
Hmm.
because people did not understand the challenge.
Correct.
And when I finished my theory papers and I came to know that Dr. Sambashiva Rao from JIPMER is coming as an examiner, at that time we couldn't go to the net, na? We had to
Hmm.
go to books.
Correct, correct.
Index Medicals was
Hmm.
thick tomes.
Correct.
I see this man in every other field. He's done papers in virology, he's done papers in parasitology, he's done papers in bacteriology. I mean, what else is left? Fungus also. I didn't know. I mean, this thing. I was scared when I went into practical exams, and it's a 3-day practical exam.
Correct. 3
We-
days.
3 days.
My
we
goodness.
have
What
to.
do they do 3 days, sir?
We are given specimens.
Okay.
We have to grow the bug.
Oh, you really?
Yes, identify
Oh,
it without
wow.
a problem and
Ah.
tell. And you won't believe I did reasonably well looking back now, but at that time, I felt I had not really done to the best of my ability.
Got it.
So after the exam, after the 2.5 days, he had called me for Viva. He finished the Viva, and at the end of the Viva, he called me and told, "Young man, how do you think you have done?" I very humbly told him, "Sir, I haven't done very well up to this thing. I will see you after 6 months." He
You told
started
him,
laughing.
huh? You told the examiner.
Yes, I told him
What
because
courage you had to say that.
no, I was devastated because I was telling that I would have done better,
Got it. Got it.
and you won't believe his laughter could have been heard over the campus. He started laughing. He told, "Young man, if I tell you that you have done well,
Mm.
what do you think?"
Mm.
Uh, Sir, I don't know, I told him. Then he told, "Okay, you're passed. Now tell
Oh.
me what do you want to do next?"
Mm.
Sir, I haven't thought about That is the time he offered me a job and told, "Come to Pondicherry and this thing." So I put a rider there also.
What rider you put?
My wife was my classmate, incidentally.
Oh, like a love marriage.
Yes.
Oh, excellent.
And she was from Kumta, which is the coastal part of this thing. And I told him, "Sir, she's done her pathology and I won't be able to move without her." Then he told, "No problem, I'll give her a job." So that's how both of us landed up in Pondicherry, and no regrets. My 2 children are born in Pondicherry. I had
Pondicherry
to.
is a beautiful place.
Yes.
Ah.
And the campus is lovely.
Yeah, I've never been inside the
And
campus.
let me also tell you that it was there I picked up much more than what I was doing here. I had a instance in Hubli where I isolated diphtheria, and that child we saved because I could identify it by the Albert stain and then tell these people to give anti-diphtheritic serum.
Whooping cough,
Yes.
diphtheria. Huh.
Not whooping cough. Whooping cough is different. That's
what's-
pertussis.
Oh, pertussis. Sorry.
So this is diphtheria. You get a
Okay.
white membrane. in the tonsil,
membrane
yes.
on the throat. That's it.
Then I isolated it, showed that it was toxigenic, and you won't believe the whole pediatric department had come there to see what all things I had done. And they were very happy. I worked with brucella again. You know how infectious that virus is. Bacteria is. And I also very clearly was this thing that when I get a positive test, I would immediately pick up the phone or go across, because that time no mobile phones were there, and tell the doctor, "Sir, I've got this in this patient." And I would also go and see the patient.
We have a similar lady now, Dr. Geeta Bhatt. You may be knowing Dr. Geeta Bhatt. She's
Yes.
also like that. So very proactive. She chases us wherever we are.
Good.
We say, "Dr. Sharan, this is," and if she feels that some infection is not expected, she says, "I need to come to the ward and see where is the cross infection going on." She's at it
Absolutely.
like a strict teacher. She will come there and catch everybody. Are
It's
you
very
sterilizing? Are you
important.
doing this? Are you doing that? We love her for that.
And you won't believe it, Dr. Sharan, unless and until we see what is happening, hospital-acquired infections cannot be, taken care of.
Correct.
I'm sure you'll agree with me, because it could be a small thing like one of the attender not really sweeping the thing. I had a case where one of the OT attenders forgot to drain off the blood warming bath water. I had Pseudomonas infection being caused in 3 cardiac surgery patients. You won't believe it. Same day, I was wondering what happened. Luckily for me, when I talked to this fellow, he told, "Sir, I think I have made a mistake. You asked me to drain this fluid every day. I forgot to do it on Saturday." That's where the bug multiplied and we had 3 infections. I still remember the patient's name. One starts with S, another starts with G, another starts with P. I don't want to take their full name.
I agree.
These were the only 3 cases where I used higher antibiotics in the Heart Foundation. Dr. Devi Shetty really appreciated because he told me to stand up in one of the faculty meeting. He told I was wondering why he's made me stand up. He told, because of this fellow, our packages have succeeded because we have not used antibiotics and it has really worked. And you won't believe, we were using amoxicillin clavulanic acid.
I remember that.
And we were using gentamicin and ciprofloxacin. That's it. Nobody else could prescribe anything else.
Now let's change track from the passionate world of what you built up till JIPMER and you coming into Manipal. You are, I think, on top of your game, excited, doing a lot of things. In MHB, I came in and you changed the lab culture in MHB, you told me. What was that you did at MHB?
Now, even when I was in JIPMER Pondicherry, people used to use me as a senior resident and they say, they used to come and tell, "Hey Satish, let's go for a cup of coffee, man."
Okay.
Actually, you know why they wanted me to go for a cup of coffee? They
why?
wanted a specimen to be cultured. So this is
They had an agenda.
Yeah. Sunday and after this thing, work hours, 9 to 5 was again something that we worked. When I came to Manipal, again, very clearly, we had so many ICUs, medical, neurosurgical, pediatric, neonatal. I was really worried that we were working 9 to 5, 6 days a week. Sunday was holiday.
Correct.
I was...
For only the lab is not...
Yeah.
The hospital is working,
Hospital
but the lab...
is working. The lab is not working. So I got worried. I sat with my technicians and you won't believe it. I explained to them what we want to do. Then I took the story to the management and told, this is what I want to do. Give me one extra technician and we'll run the lab 24/7. And you won't believe it. We ran the lab. Again, naturally, the management came back and told that it's making good sense because we are making more money. But more important than that, lot of clinicians like you came back and told, because of this, we were able to pick up the infection earlier.
Correct, sir, because every minute, every hour is important when you start an antibiotic or whatever it is to prevent it from spreading. So I think it's very valuable what service
and
that
you
you
won't
did.
even believe this, Dr. Sharan. I brought in automation for this very fact. Look, I have seen automation in many of the institutions at that time. I'm talking about 98, 99, where people used to keep it in the lab, shut the lab and go. The equipment used to beep telling, I'm positive, but nobody would take care of it. Our equipment, we bought in Bactalert for blood cultures, we bought MB-Bact for tuberculosis cultures. Every time there was an alert, I made sure my technicians were empowered to download it, do a gram stain, report back to the ICU telling I have a gram negative or a gram positive bug. I used to come and confirm that the next day. That's different. And at that time, no mobile phones. It was all landline. And they used to call me and tell, sir, we are seeing this. I tell, please call up this thing, tell the resident there that this is something. The next day, we used to give this thing. To give you an example, a blood culture normally used to take 48 to 72 hours to report. We used to report within 18 to 24 hours positives. And imagine...
You used to give sensitivity also?
Yes. With the sensitivity. in
Excellent.
24 hours. And you
I
can
remember that.
imagine, because of automation again.
Correct, correct.
And again, automation, the hospital didn't invest in automation. I got it on reagent rental. I used to buy so many bottles, you keep the equipment free.
This happens only in India, so it doesn't happen anywhere else,
Yeah,
I think.
yeah.
Mm.
And you won't believe it, because of that, I saved a person's life. One of my persons whom I knew was in the ambulance when he called my landline at that time. It was not a mobile. He told, sir, he was crying. I told, what happened?
Mm.
He told, my friend's wife has been asked to go home because they cannot do anything further. And this thing. I told, what happened? She delivered and she's got infection. You know, this thing, postpartum infection.
Post-sepsis,
I told, nothing doing. You turn that ambulance and bring her here. We got the bug. We gave her, at that time I was doing a study on carbapenem.
Mm.
It had just, meropenem had just come in, and you won't believe it. This lady walks away from the ICU on the 6th day into the ward.
Amazing, amazing.
And the story doesn't end it there. I thought I had done my good deed for the day. I thought, okay, chalo, kaam kar diya. After 3 months, she comes again with a small child, and she puts that child on my lap and tells, look, this is the baby whose mother you saved, and because of this, today I have this child as a mother. And that baby promptly was holding my finger, passes urine. and you won't believe it, Dr. Sharan. I just, luckily I didn't feel, because I was wearing my apron, and I usually used to button my apron all the time. My staff member, who always, anytime a patient is there with me, she used to be there. She told, sir, just stand up, please, and give the baby to us. And then she tells me, sir, the child has passed urine. And you won't believe it. I told the mother, hey, don't worry. The hospital will wash my apron. And I think this is the way your child, who's not able to talk to me, is thanking me for saving your life. And my staff was laughing after this.
I can imagine.
She was telling, sir, how can you even think like this?
Correct. I agree.
So,
That's
I mean, there are
hilarious.
many things like this I've done.
Perfect. I can imagine.
I mean, it was really fulfilling, because I'd forgotten that case. And when she brought
Yeah,
the
for
child,
us, it's like that. All in a day's work, as what we say as we goes to. But many stories stick like this. I also have so many stories like
I
that
know.
sticks.
I mean, it made my day when she came and told
Absolutely.
me this
So
child
yes,
has a
for you,
mother.
yes, for you it was just another patient. For them, it's a life, a mother, and
Yes,
everything else.
yes.
That may, only the person who has been at the receiving end of the beneficiary will understand the impact of this whole thing.
Correct.
So now we'll change track to 5th September 1998, the day that changed your life. 5th September, right?
5th September,
5th
yes.
September. I know it was your wife's birthday. You had
Yes.
rushed home in the evening and something happened. Can you tell our viewers what happened on that day?
It was, I think, somewhere around 7:38.
Okay. In the evening.
I'd
In the
rushed
evening.
as usual home. By the time I'd reached home, it was 7:38. On the way, I saw that my tailor was just, 3 houses that side on the main road was open. And my mother wanted to get some clothes stitched for the puja. So I picked up the clothes which we had bought and went and delivered it there. And he took the measurements and all, and it was a bright lit shop. And the whole street, there were no lights. So when I walked back, I could not see anything, basically because it was dark. Suddenly I felt something very burning hit my face.
Hit your face?
Hit my face. I mean, a lot of fluid, this thing, I started screaming. My neighbors came, and then they saw that acid was put on my face and my chest and all that stuff. And
Acid.
they poured water, and then my wife came around, and then she took me to the hospital. I still remember, Dr. Sharan, me coming into the this thing telling, please put more water. And after that, in
It
that
was burning.
wet clothes, it was
Mm,
burning.
mm.
Then I came into the emergency, and I still remember telling, please take care of my eyes. I'm not able to see. And this thing. And after that, for about 2-3 days, I didn't know what happened. There are a lot of surgeries, and they must have sedated me and things like that. On the fourth or the fifth day,
Mm.
a colleague of mine who was a ophthalmologist, he was the head of the department of ophthalmology at St. John's. He comes and tells me, Satish, this is it. You will not be able to see anymore.
My goodness.
And you can imagine how much
I
of
can imagine, sir.
devastation that would have
I
done.
can imagine, sir. I can imagine.
Dr.
I was
Sharan,
there.
I didn't sleep that day. And being not able to see, you don't even realize it is day or night. The only way I could make out is the tick-tock of the clock in the room. And later on, I realized that the traffic sounds tells me it is day, and the stoppage of traffic sound is night. This is what is happening. And, it was a huge turmoil. I couldn't sleep properly. I mean, it was too much of this thing.
What was going on in your mind when you're lying in that hospital bed after that ophthalmologist told you you'll never be able
I told,
to
that's
see
it,
again?
finished. My life was over.
Mm.
I mean,
I can imagine, sir.
I mean,
For you as a microbiologist, vision is everything.
yes.
To do
And
all your work.
sight is very important.
Exactly.
And as you rightfully say, without seeing, what can I do? And you won't believe it. This thing, I must have wallowed in that, depression and whatnot. It was subsequently my daughter and son, along with my wife, came to.
How old were your kids at that time, sir?
My daughter was around 12. My son was 6. And 11, I think. My daughter was 11 and my son was 6. I touched, put out my hand. Even this hand, everything was burned.
Oh,
And
hand was
only
also burned. Yeah,
yes,
okay.
yes. Very little I could touch her face. I saw her wet face. She was crying silently. That is the time I decided, oh my God, what's happening to our life? Again, I thought and I told, let me fight this out. That is the very day I told my sister I would like to walk. I would like to go around this cot. And that is the time when my fight started. And you won't believe it. My son, equally the thing, when I came home, he is a cricket fan. He told, Dad, let's play cricket. I was worried, how can I manage that?
Correct.
He had made a corner on the terrace where if he hits the ball, all I had to do was move my leg a little. I'll find out where the ball is. And he'll make a sound on the bat. And I'm supposed to throw the ball at that sound.
Oh, okay.
So this was what made me think, if I can't see, and if this child can look at doing things differently.
Correct.
And my daughter told very clearly, I want you to feed me. And imagine, I was scared what I'll give the same.
Correct.
And I made sure that at that time, you won't believe it, I decided to fight. And let me also make it very clear. I sat with the NESA coming into my room because I was undergoing surgeries after surgery.
How many surgeries did you undergo?
6 surgeries.
6 surgeries.
Dr. Niranjan Kumar and his team, Dr. Ananteshwar and all, really worked on me.
Correct.
And
what all surgeries did you undergo, sir?
Plastic surgery on my face and little bit of the other thing. I always keep making fun telling that my thigh is on my face.
Correct.
Because that's the skin that they took.
Correct.
And they tried a lot on the eye. Dr. Vani was there.
Correct, I remember.
And they tried a lot to do something, but nothing could be done because the acid seeped through and it had damaged the retina. So that was it.
So both eyeballs are completely damaged, sir.
Yes.
Very sad.
And I don't have, doctor, I don't have any eyeballs. And that again made me, the thing is, let me see. And you won't believe it, my staff at that time, they used to call me on the telephone and tell, sir, I've got this. What do you want me to do? And mind you, I knew, I have trained those very staff.
Correct.
I knew they know what to do, but they were trying to keep me engaged. Then when Dr. Nesa came to my...
Dr. Nesa, our CEO, or
Nesa Kumar Joseph.
Yeah, Nesa Kumar Joseph, I remember.
Doctor...
Very nice guy, sir.
Very wonderful
excellent
person.
Human being, sir.
He came and sat next to me and he was just talking to me. Then I put him a small request. Sir, can I come back? You know what he told me? Who's preventing you? And you won't believe it. He was the person who gave his personal laptop to me initially.
Wow.
He had made the computer department download the software. Told, doctor, try whether you can use this. And I found that I could use it. He got me a PC. Then, of course, at that time, Internet Explorer came in. I found that I could get a lot of information and I could scan documents and read it. Really made my day. I told, maybe I have to look at it differently.
Got it.
That's how my journey started. I went on to do what I can, and it was a lot.
Brilliant. Amazing.
So this was something.
Sir, hats off
I
to
think
you and your
my
person.
wife also supported me. You won't believe it. Even when I wanted to travel alone, she would allow me to do that. Of course, half the time she would be worried and call me up later to find out if I reached safely or not. And to give you another anecdote, I have a track of how to go and which turning to take and all that stuff, even though I don't see. And you won't believe it. One of the days when we were coming back I was coming back by auto, I told the driver, Al mundgade Dickinson Road al right tangudi. He turned back and told, sir, nim nijavaga kankansalla.
He was very stunned, I think.
He was stunned.
I can imagine.
So I like that. I worked across the hospital. I've looked at, the things like they used to get scared if I was coming for audit because they tell this fellow has a tendency to find dust where we don't see it. So, I mean, like top of the OT lights, cupboards, inside the cupboard, I would to find out and tell what is this. Because for me, dust means they have not cleaned it.
Correct.
So that's
hygiene is fundamental.
Yeah. And I've empowered even the housekeeping staff.
You were telling me that.
And also the other junior staff, the nursing.
Tell our viewers about that, how you empowered housekeeping. Because these are all the lowermost portion of the pyramid. Nobody cares about them. What did you do to them?
One thing was, wherever I went, I made sure that I used to call them by name. And they used to feel very proud of that, doctor, nan hesaru kuda gottide anta. Then another thing that I did was, I was training them as a chairman of hospital infection control. I was given that thing of reducing infection rates. So one of the primary things that we had to do was, we made sure the hospital is clean. And how to do that? So initially I told, this is the way I want to do. Then one of the housekeeping fellows separately came and told, sir, hang madadkinte ing madidre, this is better. Which is absolutely right, because he knows his job better than me.
Correct.
And I recognized that. I told, Gurugale, neevu bandbut matadbeku ellarge. Henge adan clean madodanta. And you won't believe it, we threw out hypochlorite. We brought in a disinfectant which smelled nice. So that hospital smell you will never forget.
Correct.
Again, I made sure these fellows trained each other, and more importantly, they were given this thing, telling that today the infection rates in the hospital is low is because of you. And I used to make sure, I used to tell this in front of the administrators of their, staff. And again, the nurses, everybody, I used to ensure that any feedback given is taken across, not only talk to the doctor, but also to the administration and this thing. And we used to make sure all the important ones were recognized. I'm sure you would have attended the hospital day celebration
Yes,
where we
yes.
recognize their work and
Absolutely,
input.
absolutely.
All that built up a team. You won't
Mm.
believe it. Any of them would be very clear. And even alcohol, not the drinking kind, the rubbing kind, I made from ethyl alcohol because again, I never used to like the other one. And I made sure the emoluments were made, and this was manufactured by one of the companies for us. And you won't believe it. I used to promote it to the people, telling, if you use this alcoholic hand rub, your hands will be so soft that people would want to shake hands with you. So, I mean, the compliance would be more. Imagine a person going and washing for 10 patients. I'm talking about the nurse. Every time she touches the patient, she has to go and wash with soap and water. It's not practical.
And it actually starts making the hand feel very dry and rough.
Yes.
Yeah.
I brought in 90 protocols benchmarked to international
9-0.
CDC. 90.
This all that after you lost your sight and
Yes,
got back.
yes.
Whoa. See that, guys? He did not sit at home, crib and cry. 40 days after this acid attack on his face, 40 days after he had undergone 6 major surgeries on his face, he had lost vision both eyes. Here is this man who's gone back to work, and he is not, driving everybody else and implementing protocols in one of the biggest corporate hospitals of that time, even now, called the Manipal Hospital, Bangalore, which is an old airport road, and all their branches. Sir, hats off to you. I can't imagine that if you all get 10% of the, the drive, that zeal that you have, I think all of us will get. So you see here, guys, my poster says, eyesight does not equal to vision. This man lost his eyesight, but his vision only multiplied. He was able to see much more than much further than what many of the other people could see. Sir, continue with your protocol, sir.
And 90 protocols had got. After looking at what we were doing, looking at CDC from the US, then the CDC from Europe, and also the Government of India guidelines, I made sure we brought in the best practices customized to Indian practices. And that really made the difference. We had the lowest ventilator associated pneumonia, lowest post-surgical site infection, lowest bloodstream infections. I mean, all this was because we made protocols, we audited the protocols, we empowered people to practice those protocols.
All of them are important steps.
Yes. Otherwise, it's very, very difficult.
Correct.
If one of the chain is lost.
Correct.
Because please understand, the weakest link is the person who doesn't wash their hands.
Correct. Correct.
Right. So I made sure everybody was understanding why we ask them to wash or why we want them to clean a thing in particular way, how to take care of that access of the IV line.
Correct.
Everything was protocolized, and more importantly, it was audited.
That's the key.
Yeah, that's the key.
Correct.
Because we audited and we did not try to pinpoint and point out fingers telling this is fault. We tell this is happened because we didn't do this. I did not tell you. So that made the difference.
Amazing.
That really
Amazing.
allowed us to this thing. And you won't believe it, we have taken these protocols across the group and it is practiced in all other hospitals.
Amazing. Fantastic, sir. Fantastic.
And it was really lovely because we audited everything, we checked. And of course, at that time, even I was given the job of pushing quality in the hospital.
I was just going to ask that question. What's your role in quality? You said auditing.
So,
it's natural. The moment you started auditing well, you said this is the right guy for this job of quality because that's dirty work of checking every day.
Yeah. I was considered to be the stooge of the management, trying to push this thing. But again, I made sure that we never tried to, point fingers. we made sure the best practices are discussed
Mm.
and owned by the
Correct.
people.
Fantastic. Discussed and owned
owned
and implemented.
and then implemented.
Mm.
And that way we got complete compliance of people doing the things in the right way. We got ISO 9001 2000 certified, one of the first for corporate hospitals in India. And then, of course, we didn't stop there. We went ahead and got NABL for the laboratory, because basically I believe anything that I do should be benchmarked. I felt that everybody in the laboratory also joined in. They told, yes, what you say is right. If we tell the blood sugar is 90, anywhere in the world you tested, it should be 90. So that's how it was. And it was amazing. Everybody came together. We got the NABL, again, one of the first few laboratories in the country to get it. And of course, I got the hospital ready for NABH. And by that time, the hospital decided this fellow's relaxing, let us give him another job. And they asked me to go ahead and become the medical director of Manipal Cure and Care. That's a different story.
Whoa.
And
Excellent.
in addition to this, I
Mm.
was also given the charge of running distance education for
Uh-huh.
Manipal University.
I see.
Again, I did
Huh.
a difference.
What do you do there?
It was a course for people who have done diploma, medical laboratory technology, medical imaging technology, hospital information administration. They could upgrade into the bachelor's course. Now again, I got all these first few students who joined us. I asked them, look, do you want me to hold classes in the end of the day? And
Oh, because they're all working professionals.
yeah, they're all working.
Correct.
So, are you comfortable at 5 o'clock? Are you
Mm.
comfortable at 7 o'clock?
So you actually took a vote from them itself.
Yes.
I think you
And
must
they
have been the
keep-
first who even bothered to ask somebody such a
Yes,
question.
yes. And you won't believe it. They came back and told, sir, it is going to be the end of the day. Or even if you do it at the beginning of the day, we have to get back to our work. Can you please hold it on Sunday? I was a little worried because, look, I am prepared to come on Sunday, but everybody else has to also come, no?
Correct. All
Because
the other
the other
teachers, yeah,
consultants also had
correct,
to
correct,
join in.
correct.
So I put all of the consultants together. I told, look, this is the thing. Can we at least on alternate weeks come and take classes for them? Which they did. You won't believe 250 students plus one of the highest in the distance education outreach clinic, centers. And today they dot the globe. Even today they get back to me and tell, sir, we are doing this.
See, sir, how much of an impact you have had on people's lives. No, your enthusiasm is infectious more than the viruses, I think.
Now that is dangerous.
Not at all, sir. Your enthusiasm, your courage, your striving for excellence in spite of not able to see, I think it's unparalleled. Sir, hats off.
Again, Dr. Sharan, it was basically what was driving me was my family, of course, and on the other side, the patient. I want anything that I do, I wanted to do the best thing for my patients.
You see, guys, he has put his personal tragedies aside. He continues to serve the public where others are worrying about themselves, their personal space. Here is a man, he's come all the way alone today, catching a taxi to this place. He is not afraid. He knows exactly that universe will take care of him and do what he has to do because his agenda is very big and it's not selfish, it's not personal, it is for the larger good. Absolutely great, sir. So continue, sir. Please continue.
Again, when I was asked to take over of Manipal Cure and Care, the management felt that this fellow has not got enough work. 4 people took over my work.
Really?
Yes. One person in quality, one person in microbiology.
All with vision.
Yes. And one person for distance education.
See, I told you.
One more person for quality.
You're 4 times more virulent than.
Again, in Manipal Cure and Care, I was
Incredible,
given a job
incredible.
of re-engineering preventive health, wellness, and beauty concept clinics. You won't believe it, Dr. Sharan. First thing I decided was I need to make sure this ambience in this place is different.
How did you even see the ambience?
Oh, very simple. Like you get me a plan. I used to make the architects and the engineers take my finger over everything.
Okay.
Like they will tell that this is this wall, this is having this windows, this is the door. I will tell no, we'll put the door there.
What? Really?
Yes.
Sir, how did you do all these things? I want to know as a neurosurgeon how your brain got rewritten with all these things.
Maybe you should peep into my brain.
I am going to peep into your brain and see. I always give this as an example. How is this brain so neuroplastic that it does all these things? Amazing.
And you won't believe this. I used to go and visit the site. I used to feel the walls. I used to feel this thing. I tell, let us break this or let us put something here.
Incredible, sir. Incredible.
This was what? In fact, Dr. Venkatesh Krishnamurthy and his team, he also tell this fellow can see more than what we can see.
Very true. Very true.
So I redesigned laboratories. I redesigned the concept of Manipal Cure and Care. You won't believe it. Health check. We were completing comprehensive health check within 4 hours.
Otherwise, how long was it taking?
It used to take at least about 6 to 8 hours.
Oh my goodness. One whole day.
Whole day. They would come in the morning. They used to wait, visit one particular specialty, then move to the other specialty and that. I redesigned the place in such a way that you do a ECG in one room. You would have changed, right? You move through an internal door to the next TMT room. And again, if you're not able to do the TMT, again internally to the echo room. So in this way...
Same gown so that they don't have to change.
Yeah, they don't have to change. So time is saved.
Got it.
And even I made sure samples for fasting is collected at home. Home collection at that time. I'm talking about 2008.
My goodness. You must have been one of the first to do home collection business.
Yes. I mean, we pioneered a lot, actually.
No, I can imagine, sir. MHB was always, Manipal is always ahead of the curve in anything. They are very early adapters, or more than adapters, I think, pioneers in most of the things.
And we put colors. Beautiful, mild blue for wellness. I mean, preventive health. Green for wellness. And a magenta for beauty. I brought in lasers and other things to we do face analysis in Manipal Cure and Care.
What do you mean by face analysis?
Put a face there.
Okay.
It will tell where are your wrinkles, what are the things of your skin texture, this thing, what can be done.
Wow. I didn't know all this even existed.
Mind you, at that time.
Wow.
And I love using information technology.
We didn't talk about that. We should come to that.
Yes. Yeah. And I used to use that. And you won't believe, the case sheets could be migrated from Bangalore to Pune or Bombay or Ahmedabad, like that. So this was something that we did, and you won't believe, even today people talk about telling that, oh my God, the ambience was different. It appeared as if we were going to a mall rather than to a medical facility.
But amazing.
And
how could you visualize
appointment.
How could you visualize that? I want you to tell our viewers, how did you continue? See, as you know, as human beings, we are very visual. We think visually, we don't think by, words, as you understand. How did you continue to translate to see visually without eyesight?
Sir, very simple. Touch.
But I mean, you don't say very simple touch. I'm not going to take that answer. You tell me the juice. I want to understand what you did.
I was a little information technology savvy, right? I used to pull out best practices globally and see what is the difference that technology is doing and what can be the value add we had. I'll give you an example. Like I'm sure you would have done BMI, looking at body composition and things like that. We brought in technology which used electrical impulses to tell how much of muscle mass is there, how much of fat is there, where it is there. And mind you, again, 2008-10, we were doing this. And again, I brought in the cutoffs from India. People were using American cutoffs. For them, normal body weight was 18 to 25.
Oh, you rewrote the normative data?
No, I didn't rewrite.
Huh.
I pulled out from the National Institute of Nutrition, Hyderabad,
Okay.
and told this is for Indians and we need to use this in India.
Got it, got it.
So those were the cutoffs, and I was very good at data analysis. So we used to use that very much because of information technology and tell corporates, Charlie, this is the health of your workforce. If you don't change,
You're going to pack up.
No, you got to spend a lot more money because they will only listen to money.
Correct.
See,
guys, everything else will be translated to money. You should tell Trump this. Trump mama has to be known about this.
Otherwise, you lose a lot of money on insurance and your insurance premium is going to go up. And of course, productivity is definitely, yes.
Again, it's money. Product goes down, money goes.
Yes. And that is where they made up, sit up and listen. And this thing. And another thing I brought in was, I was worried at that time when I started mental health in corporate clinics. You won't believe this.
This is corporate clinics means you had clinics inside corporates.
Yes.
Huh?
Yes.
I see.
This
was also new at that time.
That's one of this thing, that responsibility that is given to Manipal Cure and Care.
Oh,
they'll set up corporate clinics in various things. And when I deployed,
so you were deploying people there?
Yes, we were deploying MBBS doctors as general practitioners.
I see.
Then we had physiotherapy, we had dental surgery, then we had psychology. And you won't believe it, psychology I was so scared because, the amount of bad it connotes. People don't like to tell that I have a mental problem.
Correct.
And you know how much of problem is there in today's world. I have spouses fighting on small things. They're not able to interact and make that,
compromise
and support each other. They will fight tooth and nail. And in addition, because of that, the child gets into a problem.
Impacted. In fact, our September end episode was on mental health, sir, with Dr. Preeti, psychiatrist. Those who have not seen it, please go back and look at that mental health.
Sure. I think it's so important. Correct. Actually, in today's world, I'm worried about my children generation, I'm talking about less than 6 years. They are so hooked onto
the devices.
Mobiles.
Correct.
That they don't have social skills.
Exactly.
They don't even know how to greet another child.
Exactly.
I'm so worried.
Very
what
well
are we
said,
doing?
Sir. I agree, sir. Very well said. They don't look at you in the eye. They have no idea. Yes, I agree.
Social interaction, zero.
Zero. In fact, I was reading an article last week from Times of India which said that 5-year-old children are having hypertension now, high cholesterol and running into trouble. It's become a major issue.
And the reason? Husband and wife both working. No time for child. Fast food.
Swiggy. The children only can order Swiggy.
Yeah. And the problems of super fast food.
Correct.
And how much of wrong chemicals are there in that. And today, because of which we are seeing cancers in young child. Cancers, then as you rightfully told, lifestyle disorders like hypertension,
sir,
diabetes.
We are seeing strokes in 17-year-old, 18-year-old people, sir. It is ridiculous.
Which is sad.
Very sad.
We were all brought up by playing on the street.
Literally, we had to mother had to chase us inside the house. Homework we used to be escaping.
So, we used to run around.
Correct, absolutely.
Cycle.
Run around cycle, sir.
Yes.
Yellow cycle.
Yeah. Same thing. I used to go to college on cycle.
Mm.
And I used to be very proud because at that time my dad had a cycle which was made in England. ಅದು ಮುಂದ್ಗಡೆ ಒಂದು ಚಿಕ್ಕ ಲೇಬಲ್, otherwise it looked like any other bicycle. But it was more important, it was the exercise component. And today's corporate people, they morning they get up, no sunlight, go and sit in the workplace,
Correct.
they get tired,
Mm.
come home, sleep.
Ashte. Tinted glass, I agree, sir. It's becoming very bad.
Very, very
Absolute,
bad.
Very bad. Very bad.
No,
So-
I've done analysis of corporate health check.
Oh, really?
Yes.
So, what's your report? Tell our audience the
You
report.
won't believe this. Most of them have the BMI in the overweight, obese, and morbidly obese category. Some of them are in the under this thing, below 18.
Mm.
But most of them are in the obese and morbidly obese category. Very sad. The waist to hip circumference, and of course, a new parameter which has come, the waist to height ratio, which should be less than 0.53 for Indians.
Waist to height ratio?
Ah,
Oh, I have not heard of this.
That's a recent one that has
Okay,
been
okay.
put out. You won't believe it. If I look at the data, it shows me that youngsters, I'm talking about 18 to 25, they are having impaired blood glucose, they are having cholesterol in the wrong place, then liver enzymes somewhere skewed, and in addition,
Sir, when we were young, who was even testing all this for us, sir? You tell me. We were not bothered about any of
I
this
know,
test. Alva.
That is because our lung and this thing and all was healthy. Because we used to run around.
Exactly.
Tell me,
Sir,
how
think
much
about did you even think of a blood test when you're 25 years old? I don't think I even thought of a blood test when I
I
was
didn't
25
even think
years.
of a doctor.
Absolutely crazy. It's becoming too much crazy. In our lifetime only, this so much has changed. My goodness.
I know.
This is too much.
Again, this analysis has been possible because of my IT.
Correct. I was going to, I'll come to that. That's my next agenda now. So now we need to go to IT. Dr. Satish Amarnath and his tryst with IT and technology. Sir, you told me on one side you were industrial microbiology and then you wanted to medical microbiology. In between all this, you started digitalization stuff in JIPMER and all. How did you get into coding or computer or software, whatever it is? Please tell our audience. What made you get into
began as a fantasy.
Fantasy?
Yeah. I mean, because at that time computers were just coming in.
Okay, this is 1980s.
Yes. I'm talking about 1989. 89.
Okay.
This thing, computers had made an entry.
Correct.
Before that, we were using typewriters. You remember?
Correct.
Then, when I shifted to Pondicherry, this thing in 1986, we had our cardiologist there had got a computer for the department, and the PNSM had a computer. So I used to go up there and see, because at that time, the first time, the PubMed at that time, which was known as the National Medical Library, was available on CD-ROM. I used to go and pull out this thing for my postgraduates, everything. And then we downloaded a software called EpiInfo, which is still there. Today, the versions have changed. The new ones are there. I pulled out and we used to do analysis of the thesis work and all that stuff using that software. That powered me to think, let me look at what we can do. And at that time, a cardiologist who was there, he started a doctors' computers club. And which actually gave me the basic knowledge of DOS, Disk Operating System, and another software called BASIC.
Were you responsible for doing this in Manipal also?
Yeah, I'm coming to that.
Yeah.
I'm coming to that. So this allowed me to really widen my horizons. And when the JIPMER decided to go digital, I was also asked to help in implementing the laboratory portion of it. And I developed the software, and you won't believe it. Earlier, the patient report used to walk to the patient. Okay. It used to take about 1 to 2 days to reach the patient
Correct.
after we reported.
Correct.
Now, here I had made everything screen based, and we were using all dumb terminals at that time, and the main computer sitting in another place. You won't believe it. I used to make my technicians feel so happy that if they approve the report today, immediately next minute, there's an alert given in that clinical department telling this report is ready, look it. And you won't believe it, I made sure that the software was made in such a way that unless the doctor looks at that report, he will not be able to do anything else.
Oh, I mean, he's harassing him.
Yes. I mean, because it's important, no?
I
It's
agree,
a
I
positive
agree,
report.
I agree.
He has to take a clinical decision. So this is what I did at JIPMER. And then when I shifted in 96, this thing, Dr. Krishnaswamy was the head of the laboratory
Correct.
at that
PRK.
time.
PRK, alva?
PRK. And you won't believe it, he came to know that this was another thing that I did. So I told Satish, we are today using electronic typewriters and putting correction fluid, that white fluid,
I know.
to make the correction. Can you make a difference? I told, yes, sir. I need this, this, this. He got me those stuff. And I wrote the software on Fox Pro.
Really?
Yes. And you won't believe it. I chose the department who was least enthusiastic about it. To make the first.
Which department was that?
Pathology. And you won't believe it. After I made the software, one day,
courageous, sir.
One day something happened. He comes back to me and tells, Satish, how do you expect me to report?
I know who you are talking about.
Working.
I know who you are talking about.
I know. So, I mean, wonderful. I mean, and again, interpretation was made automatic.
Amazing.
Like take for instance HB. If the HP was less than 12.5, it will immediately flag it and put a asterisk there telling it is low or it's high. So all this was done. Biochemistry I made, then microbiology, of course, hematology, blood bank, everything I made the software and gave it to them. Advantage was in the background, I was saving the data. So I could do,
apart from all the convenience.
Yes. Apart from the convenience, look, I could get the duplicate report in a jiffy. But more than that, the data that was saved, which was not able to be tampered by anybody, I made it that way. You could pull it out and analyze it age-wise, gender-wise, and this thing. That really made the difference. Now, in addition,
why were you wanting to analyze? Just for the audience to know.
Okay, very simple. Like, look, when I look at a case and I know that this particular person has got this thing, yes, I know that this person has got that particular disease and this is the way to treat. But when I want to look at it tomorrow for two purposes, what is the thing that I need to focus on to take to the community and tell, this is what is the problem of this group of people. And number two,
as a preventive health strategy,
what can be done to prevent.
Got it.
So that was the thing that I really worked on.
Amazing. So viewers, just to pause, Satish sir, here is the man who was going much beyond his mandate. His job is just medical microbiology. Something comes his way to give a report and do this and go home. He is looking at prevention, doing this, doing that, data analytics and all that. Today, everybody is talking AI data, sir. You are talking 1990s.
Yes, sir.
Which is 1990s to 2000, 30 years.
And you won't believe it. At that time, many people were not comfortable with the
So
computer.
what
They
are you
get
saying?
scared.
Of course, I remember myself. I don't know whether you were responsible. I was still a student. They said computer class for all the doctors, and I actually went and registered, and I went and took the class. I don't know whether you were responsible for that.
Yes,
That's
yes.
when I started typing all my discharge summary myself. So the end result of that is I started typing my summaries myself. Made a big difference.
Rolled out two softwares for the hospital.
Mm-hmm.
One was the software that all of you used in MHB. The other one was Wipro software on the various other thing. I was the subject matter expert for selecting the computer and more importantly, customizing it to meet our needs.
So I'll give you my own personal efficiency process. See, neurosurgery department was so busy at that time. We were always short of stuff.
Hardly we could talk to you.
I agree. Literally running out like a headless chicken all the time, 36-hour calls. So discharge summaries, we used to have 25 admissions, 28 discharges every day, literally. So discharge summaries had to be typed and given. So we used to have this habit of handwriting it. Then
Correct.
the typist has to type it. She is not subject matter expert. She will make hundreds of spelling mistakes. Now,
White correction
then
fluid.
she has to go, then she'll correct, retype again, retype 5-6 times. And then they are working 9:30 to 6 when we are in the OT. And it's such an inefficient process. After I took this class, I decided I didn't know any typing. Luckily, you said you learned typing. I knew 2-finger typing. I would sit from 6 o'clock in the evening to 9 o'clock.
Oh my
Every
God.
floor you gave a terminal. You remember that? So you had
Yes,
given us a
yes,
terminal.
yes, yes.
I would sit at the terminal. I start 2-finger typing. I would type as fast as the typist because she had to look at what was written and type. For me,
Yes.
everything was in my head.
My head, yeah.
So taka 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 taka, I was typed there. And what would happen is I'm in the OT. Anybody could take a printout and give it because there was no mistakes. So that in my own way made my life so easy and efficient. After that, I was hooked to that, sir.
Subsequently, I made a little better modification of that. I made a customization of a US-based software called Easy EMRX, which stands for Easy Electronic Medical Record and Prescription. You had to just click. I'll give you an example. You know, fever, we look at fever, whether it is continuous, this thing, undulating, whatever. And for so many days, it is reduced by this thing. You just click on the 4 or 5 clicks. It will, type it out in a sentence form.
Really?
Yes.
How come I missed this in MHB?
No, that was not in MHB. That was in the corporate clinics.
Oh, that's why I missed that.
Because, and you can imagine, if you just go to the examination portion, you make a button, tell everything is normal, then unclick one particular system and modify it.
Amazing.
And it will
And you
narrate in
got all
English.
this done customized for Manipal, huh?
Yes.
Huh? Who was writing it for you?
It was written by the software company.
I know.
Told I want it this
Like this.
way.
Amazing.
And this was done for the Manipal Cure and Care. I had a team of a dental surgeon, management guy, then a
Management guy was
dermatologist.
Somnath, huh? Somnath was there, no? Somnath was there.
Yes,
Somnath
yes.
is a good friend.
And he really encouraged me. And you won't believe it. It was superb and so satisfying because the doctors themselves liked it. Because they didn't have to write long things.
Correct.
I had integrated SIMS database, the cumulative this thing of
Understood.
this thing.
Yes.
It will automatically give you dosing. It will give you whether this can be given based on the person's allergies and this thing. And it will tell, yes, can be prescribed. And the prescription is to come.
Now, SIMS is available soft copy, sir, no?
Yes, yes.
Oh, so you can just put it into the system and you can. Amazing. I
It's
should
so
look at that.
beautiful. And
So-
you know where the development team is? Bangalore.
Obviously,
It's a
Silicon Valley.
US-based software.
Oh, Rama. Amazing.
I customized it for medicine, gynecology, pediatrics, mental health, then dermatology. All this was customized. And we used all the standard diseases. So everything, just a few clicks and it'll narrate in a sentence.
Hats off to you, sir. Amazing. To do it. So right now, I am running a technology company also. I have built my own software. I know how much of an effort we have put with today's technology
I know.
to get what we want. And for somebody like you to do it 30 or 25, 30 years ago, when we were so like, if you look at the technology at that time compared to now, it's like Stone Age. It's how bad it was for you to have the vision, and you were not even a technical guy. You were a microbiologist or a medical doctor. To
Yes,
look at
yes.
that.
But I was very clear. What I wanted
Amazing.
medically, I wanted it.
Yeah, sir. That's why, sir. Because you are the subject matter expert sitting there, who also understood that, you made it friendly to the doctors.
Computer engineers also.
Exactly.
I used to very clearly explain to them, let us do it so that we get this output. How
Correct.
you get that output is your headache.
Sir, amazing. Your headache, correct. Amazing.
I mean, otherwise I would have been an engineer, right?
You are already quasi.
Won't believe that software today is selling like hotcakes in the US.
Are you, I hope you're getting some royalty for that.
No,
Oh,
nothing.
yeah, that they will not do, sir. That's the problem.
But doesn't matter. It really
Yeah.
made a difference to my doctors and my
Correct,
staff.
correct.
That is important.
Perfect. So when I reached out to you to do this podcast, I told you that we are trying to launch this podcast on the first week of January, which is the World Braille Day. And you made a very simple, nonchalant statement. I don't know Braille. And I said, how come? He said, I don't need it because none of my medical textbooks are there. So can you tell us how you have adapted to being in touch with all the things that's happening around you in the world today and update yourself without able to see and read? Sir?
Dr. Sharan, there are two things here, very important. If you looked at our tactile feeling, as a child, we feel everything.
Correct.
As slowly as we become a little more adult, our touch becomes a little less.
Correct.
I'm not telling it's lost.
Correct.
So Braille is entirely touch. Okay. So I was asked to learn Braille. In fact, the fellow who really made a difference to me was, you won't believe, after the surgeries, after I was discharged, a person called Anand used to make a difference of how to walk around. That's why even today, I take a person's elbow and I go aram se, wherever the person is going. Because when you turn, the elbow also turns. So I will be able to make it. Yes.
Oh, interesting.
So, or let us say you're stepping up, your elbow goes up. So, or you're stepping down. So this is the way. He taught me that. And you won't believe it. He broke that ice that you need to get out of your house and move around. And he made me move around in my locality. So people got used to my face. Then I was asked to move around in the hospital. And of course, I used an ultrasonic device which will tell me if any obstacle is there in front of me. But other than that, I used to mostly depend on my elbows. And it took me right across all over the place. And you won't believe it. It was a lot of things that, pushed me to do. And this really made a difference. Then, of course, in addition to this, the support I had from my staff and colleagues and friends, which made the huge amount of difference.
What about the softwares that you're using?
Yeah, I'm just coming to that. This was one thing, mobility as we call it.
Correct.
The other one was the Braille, this thing that you were talking about, because one was my feeling was not very clear. I can still make out, okay, this is A, this is Z or whatever. But one thing that really pushed me off is when I went to the National Association for Blind and asked them how many books are there which are medical in Braille. They thought I was a nut. What is this fellow asking? And to convert a book into Braille, it takes a lot of time.
Okay, and it's also humongous because the number of pages becomes huge.
Yes. So that is the time when Dr. Nesa, who again I would say was very wonderful in giving his personal laptop to me, he downloaded a software called Job Access with Speech, which stands for JAWS, JAWS. Now this software allowed me to do a lot of things. Number one, it allowed me to use the Internet Explorer. Google had not come that time. It came much later. This allowed me to pull out medical information from websites like CDC, NIH, then...
How? By auditory commands, huh?
Yeah, no. I used
You
to
should
type.
type, because you learned typing.
I know my dad was a little visionary.
Mm,
He put me to a typewriter school even before I finished my 10th standard.
excellent.
So I knew typing. In fact, I use all my fingers to type. And the advantage of the software is if I press a button, it'll tell me what button I'm pressing.
Oh,
Number two, there are drop down menus which will make the menu come down and tell, let us say, I want to do spell check, I want to edit this particular page. That's the thing. Or let us say, PowerPoint, when it is on a slide, it will tell me all the points.
mhm. So you can make your own PowerPoint presentation also. Huh?
Yes.
Amazing, amazing.
And of course, final formatting, I asked somebody to do.
Correct, fair
Because that's
Content you put in.
contents I put in.
Yes, fantastic.
And number two is I make my own presentations today using PowerPoint. And way back when I was in JIPMER, as I told you, I was learning this thing. I used to use a software called Lotus 123, which was the forerunner for Excel. And Excel I use. I have made software in Excel for identifying yeast, identifying many bacteria, and I have many papers. I have more than 50 international peer-reviewed articles in the major journals of the world. I was the reviewer for many journals, Indian Association of Medical Microbiology, then this thing, Pediatric Infectious Diseases Journal, which is a European journal, then 4 or 5 other this thing. All of them because I can listen to text if you give to me in a document format or a website. I can go and read out what is there, download that information, and that's how I made protocols. So all my computer skills helped me in moving the thing. And today it is even better. I have software today on my phone which allows me to send messages by dictating. And of course, I can read what somebody else has sent. A blind person wants to use, there are options available on the uh, Android phones, which is called TalkBack. Once you use the TalkBack options, anything you touch on the screen, it will tell you what it is.
Home screen 1 of 2. Home. Messages has Google Lens. Camera.
There, I opened up WhatsApp.
Scan to rank of 4 and reserve wedding bells +9 Siddharth +91 96639.
I think
Message.
this is.
WhatsApp. Compose message.
I'm composing a message. As you can see, everything that you see on the phone, if you touch it, it will talk to me.
O-O-E-X-W space how 2 I
So you can see
space I.
the Braille watch is open like this. The top portion opens up. Then you can touch the hands of the watch, know what time it is. As you can see, it's around 4 o'clock now, 5 minutes to 4. The 12 has Braille dots, 2 dots. There is the Braille dot on 3, 9, and 6. In this way, we orient our watch, and once we finish it, we just shut it.
Search box edit, type of text. N-O-T-E, notepad, hack, refer.
Ready, ಇವಾಗ I'll type. Go.
I-S-B-I-S-B-D-E-N-O-N-S-E-A-D-I-O-N-O. Slide enter, limit menu bar, slide 1, adult immunization and
Can you see? Right now, I use it. Adult immunization is telling this thing. So when I want to move to the next thing.
Slide 2, guidelines. The major guidelines are need for adult immunization.
For this, I use a headphone. So when I'm making a presentation, people will not see. I mean, we will not hear. People will hear only me talking.
Now you respond so fast when I send you messages. Many times I forget that you can't see, you know.
Oh, that I told you, the auto driver also asked me, sir, ನೀವು ನಿಜವಾಗ್ಲೂ ಕಣ್ ಕಾಣಿಸಲ್ಲ. So, I mean, it really, technology today has really helped me
Imagine,
really
sir.
do
I know.
a lot, which perhaps allowed me to keep up abreast, and Google, of course, today. I am able to get information at the fingertips.
And
I
as
just need to
easy
type it.
as any of us.
Yes, yes.
No difference at all.
Only thing is, sometimes when there is a picture on the screen, I might need people like you to help me out.
Correct.
But that also is changing with artificial intelligence today.
How?
Today I have a software on my phone, which if I point it at the screen, it will tell me what is there. Perhaps not accurately, but
Whatever.
to a certain extent.
And the same device, if you point towards a wall or something, it tells you what's going on, or which area you're in and things like
Yes,
that.
yes.
It does.
Like take for instance, if I point the mobile at you, there's a gentleman sitting there doing this. So, I mean, even Apple has that.
Correct. So you have to put on a earphone or something for that, or it'll
No, I'm making sure that it talks loudly.
Amazing. Sir.
That's why I gave my telephone to your staff.
Yeah,
and
they'll
I told them
experience that.
keep it away. It keeps talking to me.
Correct. You've got a good companion who keeps telling you, keeps you updated what's going on. So we are going to we're going to look at a demonstration of how you have used technology when you see you adapt. See, sir, if you look at hindsight, whatever happened, unfortunately happened to you. But the way the technology that you had adapted helped you to take on so easily when you lost vision and get you back reintegrated into community and get back is amazing. No, so it's just like
Absolutely. And for me, excellence is very important.
And I can see,
and
I can hear that.
I will not allow me to give a reason to tell, oh, I didn't do this because of this.
Yeah, no sympathy. You're not seeking anything from anybody. I can hear that loud and clear from you. Loud and clear.
And lot of people, Sharan, you won't believe this. Lot of people have helped me. I thank them. And more importantly, some of my staff members today have been motivated to do their masters. And you won't believe it. One person did the hospital management. Another person whom I put into resilience did MSc psychology.
Oh my goodness.
I'm so happy, that they are motivated to do a little more. All of us do our work, 9 to 5 or whatever you say. That's not enough. We need to push the boundaries.
Agreed. What sir is saying is in this world of work-life balance, people want to work 2 days a week, 3 days. You can't build a nation. You can't build yourself. Forget the nation. You can't build your future by working only 2 days a week because the reality is there's so much more work to be done. I want to make a small note of the poster that I have put. Eyesight is not equal to vision. Lot of us have good eyesight. We can see enough, but no vision in our life. You just go around like this bumping car. You wonder. I've interviewed people, sir, at the end of 50, 55, 60 years of their life. I said, what happened to you in your life? And they have no clue what happened in their life, They always see the three kinds of people in this world, sir. Number one, who watch things happen. Number two, who make things happen. And number three, who wonder what happened.
Yes. True, very true.
What happened? My life is all done, dusted, and they have no idea what's happening. So, guys, you don't have to have vision, eyesight to have vision. And on the other side, you can have enough eyesight with zero vision.
Very, very true.
Correct, no, sir?
Very true.
And if that is one message we want to give out of this podcast from Dr. Satish Amarnath, this is the message.
Absolutely. Nothing is impossible.
Exactly. Nothing is impossible. And here this man, 1998 this has happened. We are talking 2026. 28 years later, after having lost his vision, he's as kicked about life that he was 28 years ago. Maybe more at that time. Huh?
True.
Amazing. Sir, it was a fantastic chat with you. Before I wind up, I want you to give messages to people. One, for people who are acid victims. Number 2, for people who cannot see. Number 3, for other differently abled people, give them confidence. And number 4, to the public at large. You can take it in any which way that you want.
Okay. Number one, acid victims. I'm extremely, very, very clear. Do not get worried that your face or your portion of your body is disfigured. I have sat in front of a patient. Many of them have not looked at how I look. I'm talking about when I had just finished my surgery, I must have been looked aside. A person sits in front of me and tells me, "Doctor, I have had this problem. What can I do?" So do not get worried. Pick up your things and see what you can do. And there are a lot of things that can today be done for acid victims. Do not, what you call, worry and tell, "Oh my God, this has happened. I don't want to show my face to the world." Doesn't matter. You are differently looking, fine. Let us go ahead and this thing and get that treatment. And today, technologies are available in the medical practice to make sure the scars are diminished and taken care of. I'm sorry, but people have used the burns to damage a person, but do not get trapped by it. Number 2, for a blind person, remember, there's a lot you can see without seeing. And today technology is available. There are software which not only types, it not only converts speech to text. There are much more that you can do. And today there are storybooks available. There's a project called Gutenberg in the US where you can download PDF storybooks and read it for yourself. You know, this is also for your, free time. Do not worry. Look at the world that other people are looking at. Look at what other people are seeing and trying to convey and understand what you can do. Explore what can be done. Do not get stumped by what you cannot see. Number 3, looking at
Other people with other disabilities,
yes,
differently able.
I have looked at other disabilities also. Again, I find many people, they get worried what needs to be done. How can I do this? I myself have been able to bring a lot of people into various corporates by first understanding their medical limitations and sitting with the teams and making them understand that this is possible by this person, this is not possible, and make them as productive as anybody else. I have had people who have done PhDs, I have had people who have done masters, and I have people who have grown in various corporates. And you won't believe it. I would like to give an example of this thing. A person who had lost his power in his limbs, he used to ruminate and tell, "Oh my God, what is this?" and all this stuff. I made sure he joined a major corporate in Bangalore.
Mm-hmm.
I got him an electric wheelchair,
Mm-hmm.
and you won't believe it. After about a month or so, he was taking his whole team for tea in the campus, telling, "This is the first time I'm going out with my team."
Amazing.
And that is what I have done. I have looked at not only locomotor, I've looked at nervous, and I've looked at other kind of this thing. And I've also worked with LGBT A plus people. Even gender surgeries I've been able to facilitate, where people have undergone that change of gender. Again, I like to look at a problem and see what best I can help the person overcome that. And today it's out there. I'm sure you will find that there are today ability to translate English into other languages of India. Very important. What's the point in me talking about a software which can only read and talk in English?
Correct.
It should be able to translate into other languages.
Is that available, sir?
Yes, yes.
Oh.
And make it inclusive.
Fantastic.
And mind you, it can even translate into foreign languages.
Oh, amazing. To the public now, sir. So when the
So,
people like you around them, what should the public do and how should they participate?
there are two aspects to the public that I would like to say. One is, don't sympathize and tell, oh my God, that has happened.
Correct.
Yes, it has happened. But look at what the person can do beyond that particular thing.
Perfect.
Don't look at disability and decide, oh, this fellow is
The-
blind, he
correct.
cannot do anything.
Correct. Gone case.
You look at what that person can do and support him. That's what my hospital did. They supported all my colleagues and this thing. I don't want to take names, but wonderful people.
Agree, sir.
They supported
Empower
me
you.
and saw what I could do rather than what I could not do. So next time you see a child, next time you see an adult with a disability or a problem, it could be even something invisible like a mental disability. Please help the person overcome it and produce the best available output that the person can put out. That is more important, and the community has to support that.
Very well said, sir. Very well said. So I want to share my own last bits about my association with a visually impaired organization called Mitra Jyoti. So it is headed by a lady called Madhu Singalji, who was born blind. And that lady is so dynamic like you cannot imagine. She's even got the presidential medal from Professor APJ Kalam for
Wow.
what she has done. She has started this NGO called Mitra Jyoti. I think it must be close to 50, 40, 45 years now.
Yes, yes.
And I was a trustee with Mitra Jyoti for quite some time. How I got in was my mother had got into Mitra Jyoti's, this one in the 1990s, around that same time.
Okay.
And she was a volunteer, my mother. So what she used to do at that time was, see, all these, they're basically empowering visually impaired women. Okay, that's their main focus. So my mother at that time, the internet was not booming at that time.
True.
So she would pick up all the English magazines, pick up all the news that she thought that these people should know. She would take the English version, convert to Kannada. She had this old tape recorder that we could, remember, record and play.
Yes, yes.
90-minute cassettes.
Many songs I still
Correct.
remember.
She
I
would
used to listen
record
like that.
at home on that cassette player 90 minutes of news in Kannada. And that audio magazine was called Sanchaya.
Wow.
And she used to then give it to Mitra Jyoti, and they would make multiple copies of that and keep in a library so that the women could borrow it and listen and get updated on the news.
Wonderful. I swear.
My mother has done about 250 cassettes like this.
See
sir.
how one person can make a difference.
Exactly,
My
sir.
God.
Amazing.
Amazing.
And when they would have a community event in Mitra Jyoti, and my mother used to go there, the moment they hear her voice, Madam, Nimdana Madam Sanchaya, because they would recognize her voice.
Correct.
And after that, what happened one day, Atria, one of our friends, Sundar Raju, who used to own Atria Hotel, he called me one day and said, Sharan, do you know any NGO which is doing work for children with cancer?
Okay.
So I said, why? Vijay Amritraj knows, the India's famous tennis player.
Yes.
He said, Vijay Amritraj wants to donate some money. I said, is he particular to donate for only cancer? He said, no, we want a good NGO which is doing good work. Then I said, I know this NGO called Mitra Jyoti, which is doing this work. He said, great. Can we go meet them? Vijay Amritraj came. I got him to meet Madhu Singalji. He was blown away by her. They were building an entire building to host women and train them to become enabled, empowered.
Fantastic.
Sir, he gave 40,000 USD. And
wow.
And every year he continued to give for many, many years. And the first check, when he gave, the Karnataka State Lawn Tennis Association had a women's tennis tournament, international women's tennis tournament. Venus Williams and Serena Williams had come along with their father. And they got that father to give the check in the middle of this tournament.
Fantastic.
Can you imagine? So that is what, there's so many good people in this world. We only have to facilitate and connect this whole thing, and then the magic happens.
Absolutely.
So I will make sure
and that's a beautiful word. Magic.
Absolutely, sir. I think I will make sure this episode reaches Mitra Jyoti Madhu Singalji and her team. So thank you very much for this fantastic chat we had today.
I also enjoyed myself.
I
Thank you
agree.
very much.
Sir, you have really moved me. You have inspired me to really take this forward. My commitment, anytime you think we and our organization can be of any help to
Sure.
take anything forward, please be free to reach out to us. Thank
And
you very
same
much,
thing
sir.
here. Any help from my side,
We'll do, sir.
please.
We will involve you. We'll pull you in. I heard that you're taking a sabbatical for your starting a third innings probably. So we'll pull you in and do that.
No issues.
Yeah.
No
Thank you
issues.
very much,
Thank
sir.
you very much. And hope everybody enjoys this thing and takes a positive thing and helps another individual.
Perfect.
Jai Hind.
Yeah. Before I finish the last bit of it, don't forget to subscribe to our channel, hit the like button, definitely forward and share this video and many other videos we have on all our social media channels, and definitely watch the documentary we have. We got a Rebooting the Brain book. Please make sure it's there on Amazon, our #1 bestseller. Pick up the book. There's so many different media that we have to educate people on the brain. Please do that and enjoy yourself. Jai Hind. Sir, it was such a fantastic chat that we had. I must give you a big
Thank you.
love you. Thank you so much for inspiring us to do wonders.
And do all the good things you still
We'll do, sir. We'll do. It's a
Very,
promise.
very nice.
Thank you, sir. Thank you
Thank
very
you.
much. Thank you. Sir, the book.
Oh.
Giving you a copy of the book. You can give it to. I'll send you a soft copy.
Sure.
But this book you can keep it at home. Anybody else can read.
I want it autographed.
It is autographed already, sir.
Oh, very good.
Already autographed by both of us.
Thank
Me and
you.
my wife are both the authors for this.
Wonderful.
So we are here.
Thank you. I'll go through it.